you could tell us about the corporate social responsibility.
Hinduja Hospital, we are a not-for-profit charitable organization. So, by the nature of its, formation, we are a charitable organization. But what we have done, we have gone much beyond the scope of our hospital, where we don't take care of the poor and needy patients in the hospital, but also we have gone somewhere around 200 kilometers away from the hospital in Bombay, and in the tribal areas where we have adopted more than 20 villages, where through mobile health units we provide completely free medical care to the poor and needy population. Not only that, we provide free medication, diagnostic tests are done completely there, and all these are done through qualified medical practitioners. And by virtue of that, we have seen the quality of life has improved significantly in those villages for the people. And what we have realized, that people, they come to the mobile health unit for the treatment merely because of they don't have proper nutrition, they don't know how to take care of themselves. To improve the situation, we have started providing the nutritional support to the school childrens, and we have provided education through the social workers. And by doing that, we have seen earlier the way people were becoming sick, very often that numbers or the incidents have comparatively come down, so they are slowly becoming self-sufficient. So in this endeavor, we have support from many national and international organizations, and with their help we are today covering more than 50,000 population in that area.
Wow, that's wonderful. Do you also cater to Dharavi? I mean, some parts of it?
See, Dharavi is very close to our hospital, so we conduct camp there, and those people have easy access to our hospital. In our hospital, we provide 10% of the beds for the completely free patients, another 10% for the subsidized patients. So they can come to the hospital. We have free outpatient services, so they can avail free outpatient service, and by showing the document and proof that they are from the economically weaker class, they can avail the service in our 10% free beds and 10% subsidized beds. But what I mentioned, our CSR activity, that is much away from Bombay, where people can't even think about modern medicine and they may not have access to proper medical care.
Well, that's wonderful. You're already working with the marginalized communities. So how do you think we can bridge the gap, the rural versus the urban?
From my personal experience, when you have gone to work in those rural areas, we have seen a significant percentage of the population is there in the rural India, but we don't have infrastructure, we don't have doctors, qualified nurses to take care of them. So I feel the way we have started with this rural program, if the private organizations, they come up and they try to look for this kind of activities, and of course we need tremendous support from the government, because we faced initially some sorts of challenges from the local people, that in terms of acceptance. So if government, they come forward through a public-private partnership, we can definitely provide support for this kind of good causes.
All right. Well, now we have FDI in healthcare. Do you think it would help, and what is the extent of public-private partnership involvement?
Yeah, of course. I am there in healthcare industry for last more than 18 years, and I have seen in 2000, 2005, the way the improvement or other progress has taken place from the private operators. They have come forward because it has been considered that healthcare is a recession-proof industry. Not only that, it is growing significantly year on year. So in that aspect, I think FDI will be helpful for the further growth of the Indian healthcare.
All right. What are your thoughts on Swachh Bharat and Sabka Vikas?
See, Swachh Bharat is definitely a good initiative which has been led by the government now, but people across the society, they are talking about it, but I am not sure at what extent they are joining and contributing. So in a long run, we need to ensure it should be a sustainable one. It should make impact on the overall, population rather than certain pockets of the community. And but I am happy that unlike many other initiatives of earlier, this initiative has got a lot of public support, and over a period of last 6 to 7 months, it has done, or it has created a huge wave across the country, and I'm quite optimistic that it may change the face of our rural as well as urban community.
How are you tackling with the major challenge of accessibility and affordability?
In terms of accessibility, see, if I talk as a representative of Indian healthcare, I must say that, as I mentioned earlier too, that Indian healthcare is very much geared up for the people who are in the urban area. But where we have 70% population and we have 30% services available, there the demand supply gap is tremendous. So in terms of gearing up, I feel one is people should, or rather entrepreneurs should be given some sorts of incentive to go to the rural areas where they can create their own setup, infrastructure, and with this incentive, when they feel that it is something good or boom for them, then many other people will come forward. And in terms of affordability, undoubtedly the healthcare is becoming day by day very expensive by virtue of instruments, equipments, consumables which we need to get from foreign countries or need to import. But in last 3-4 years, we have seen a lot of initiatives where Make in India campaign, along with that your productions in this country has started. I'm sure that will make many of these products very much cheaper in comparison to what we get today, and when that happens, it will make healthcare more affordable. Unfortunately, our country doesn't have more than 10% population with insurance coverage, health insurance coverage. Because of that, when people they become sick, they need to pay from their pocket, and that is making a significant part of the population to become poorer. So if there is a good initiative to get health insurance for every person or to the economically challenged set of community, that will be a good thing. But government has taken initiative through National Rural Health Mission, National Urban Health Mission, and I am sure these initiatives will make significant improvement in terms of the affordability segment. Several states have taken their own initiatives where poor people below poverty line or weaker people have been covered or given some sorts of insurance.
Right. Well, the sector has done very well. In fact, it's known as one of the best happening sectors right now, and the valuation is around $70 billion. So what's the future for this sector by the year 2028, when we are the most populous country in the world?
See, there are many predictions, many projections from different industry houses by different agencies. Somebody is telling we'll reach 200 billion, 150 billion. So I am not in favor of giving that kind of forecasted figure, but I am quite sure the way in last 10 years Indian healthcare has undergone a major transformation. The way technology, the way IT has taken a major lead in the healthcare delivery. Definitely.
Sorry to interrupt. Let's put it this way: will primary healthcare be approachable, accessible? Because we have yet not even gone ahead and achieved primary healthcare.
Yeah, the reason for not achieving primary healthcare as of now is because of lack of availability or supply of trained human resources and lack of creation of infrastructure. But with the help of telemedicine, with the help of recent that National Rural Health Mission, I'm sure that, and along with private public partnerships, there will be a suitable infrastructure by then where primary healthcare will be accessible by others.
All right. The last question here, Mr. Chakraborty. Few do's and don'ts for startup entrepreneurs who are planning to enter the healthcare sector.
Do's is you should have little patience, you should be creative, and most importantly you should keep patient's interest in the mind, and that should be the center of your entire business plan. Don'ts, don't start thinking that from day one I need to make money, and don't forget that imposing lot of technology and advanced things of Western world will be accepted by our population or our patients, because at the end of it we need to be very clear and sure that patient should get affordable healthcare. So by virtue of doing lot of new things which are not acceptable and which doesn't go along with the market needs, they should not think of.